with Dr. Araik Haddad, the Dean of the National Cancer Institute. The second one is that we are discussing now 3 schools in nursing with the University of Massachusetts, Boston, with Anahid. I think that all of us, we have to share in that. We have to share to take the nurses in a second step and the next phase in this. The third one is with Harvard is clinical research course for 1 year. It's going to be branded, and we already started with 20 students and practical here. We are doing a guest house, 300 beds, because 61 of our patients are coming from our districts, and it is the first time that we are going to have a hospice care. My mother died from cancer while she was suffering. I couldn't do nothing for her except holding her every day, getting her to the hospital just to do thoracocentesis. And she was suffering from severe pain, and the mother of one of my best friends. So it's high time now to relieve the occupancy at our expensive hospitals and to put it in these hospice care units, and to give this noble service for our dying patients and dying family members, either at the hospice or outside. This is the existing hospital. And this is how is the hospital to be looking, inshallah, after 4 years. Another 300 beds to accommodate from 75 to 90% of the pediatric oncology patients all over the country. Actually, we are not treating patients from the country only. We are treating patients from the Nile Valley, من حوض النيل, من دور حوض النيل, and from some Arabic countries. We are unable to treat all our patients. We are unable to treat all our patients, but we have been receiving education and support from other countries. وعايز افكركم بالقرآن بيقول لن تنالوا البر حتى تنفقوا مما تحبون. افتكروا الآية دي، لن تنالوا البر حتى تنفقوا مما تحبون. ربنا سبحانه وتعالى بيقول انفق مما تحب، شوف انا هديلك ايه. هو ما قالش دنيا ولا آخرة. سابها مفتوحة. ديفينتلي في الآخرة، بس في الدنيا ربنا يزيد الرزق إن شاء الله. مصر دورها كبير قوي، ولازم يفضل دور مصر كبير، ولازم يستمر يتعاظم. واحنا نقدر نبقى السوفت باور بتاعت هذه البلد بالطب وبالتدريس وبالتعليم. الكومبلكس اللي انتم شايفينه قدامكم ده في تحت هنا اكاديميه لتدريب العلوم الطبيه، والناحيه الثانيه في ريسيرش سنتر اللي على اليمين خالص، والمباني اللي ورا هي 300 سرير الجداد. ان شاء الله في خلال 4 سنين هنبقى تقريبا 650 سرير باذن الله سبحانه وتعالى. ده هيدي جوبز ل 15,000 واحد وهم بيبنوا. احنا اوريدي دلوقتي 2200 واحد بيشتغلوا في المستشفى، يعني 2200 homes are being open، مفتوحين بيوت، وما شاء الله الناس بتقبض مش بطال عشان تقدر تخدم مش بطال لحد الساعه 5، وكله بيشتغل في ريسيرش وكله بيعمل اديوكيشن، وان شاء الله هيبقى في 4000 جراديويت بير يير. عايز اقول لكم شويه حاجات جميله كده احنا بنعملها في المستشفى الجديده. احنا معلش انا دي 57357 in the future. Again this is the complex. السرير اللي فوق ده هيبقى 600 سرير، هيبقى عندنا اكاديميه باذن الله، هوسبيس كير، جيست هاوس، and we have 18 towers research center. ان شاء الله يا رب ربنا يكملهم بالسلامه وبيكم. وعايز اشكركم تاني واقول لكم فعلا انا بحب I love nurses. I love nurses. انا عارف ان المفروض انا اقول I love nursing، لان انا شايف بقى النيرسينج دلوقتي بقى، انا شايف انتوا قاعدين بتعترضوا الرجاله بتوع النيرسينج، بس بحبكم انتوا كمان وراه. تصبحوا على خير.
اهو. بسم الله الرحمن الرحيم.
لو سمحتم الاساتذه الدكاتره المسؤولين عن السكن، دكتوره نيلي لو سمحتي، دكتوره نيلي، الدكتوره عزه علي، دكتوره نيلي بعد اذنك. لو سمحتوا الهدوء، لو سمحتوا بعد اذنكم، لو سمحتوا يا جماعه، يا جماعه لو سمحتم بعد اذنكم، لو سمحتم يا جماعه لو سمحتم. ممكن الهدوء لو سمحتم، لو سمحتم عشان نبتدي السيشن. لا ما لو سمحت دكتوره نيلي، لو سمحتم يا جماعه عشان هنبتدي السيشن. انا خلاص لو سمحتم دلوقتي هنبتدي اول ساينتفك سيشن، والتشير بيرسون والممبرز كل هيقدم نفسه بعد اذنكم الهدوء وشكرا.
بسم الله الرحمن الرحيم. نبدا يا دكتوره ولا ايه؟
امسك يا
بسم الله الرحمن الرحيم. مفيش حد لسه ما عدوش.
نعم.
I am Professor Dr. Nafisa, Professor of Psychiatric Mental Health Nursing, Faculty of Nursing, Cairo University. I am presenting on behalf of Dr. Aisha. She was a chairperson for this session. And we will start the first session after the very nice words and talks they have been talking about. And we'll start the first one about new trends. And I have my colleague, they will introduce themselves. Dr. Nelly Mahmoud.
صباح الخير and welcome everyone. We are happy to have you here in our third international conference, and we would like to say that we have this meeting on a very special occasion for Cairo University Faculty of Nursing. This is our golden anniversary. We are going to celebrate 50 years of achievements of our faculty, and that's why we hope that through this very big Congress we are going to add more and more achievements to our faculties. Okay, we have now Dr. Sohair Badr. She is going to introduce herself to you before we start our, yes.
Bismillah ar-Rahman ar-Rahim. My name is Sohair Badruddin. I am a professor of community health nursing, and I am the first batch from the Faculty of Nursing, Cairo University. Thank you very much. I'm very happy to be with you, and we hope that everything will be okay for our presentations, and also your respondent to the speakers, because we would like to have a scientific good and background and exchanging between the nations, Egypt and other foreign countries. Thank you very much. Thank you.
We will welcome Dr. Shahrazad, Professor of Medical Surgical Nursing. She is one of our leaders in nursing profession. And we welcome all the distinguished guests from USA and all the participants. Okay, now we will start the first session. Dr. Anhed Kowalski is trying to pronounce it like that, the name. She is a Dean College of Nursing and Health Sciences, Massachusetts University, Boston. And she will talk about nursing professionalism and what does that mean in clinical, scientific, administrative, and leadership aspects in the developing world. How do we improve the image of nursing through professionalism? Okay, thank you.
Thank you. Good morning. Can you hear me? Yeah. صباح الخير. صباح الفل, eh? I'm so honored being here. I come from, well, first of all, my name is Anahid Kowalski. You did a good job. It's a little difficult, but that's my married name, the Kowalski, so I'm Armenian. It's Der Vartanyan, so pretty close. So I want to bring the greetings from our Chancellor, Keith Motley, from University of Massachusetts, Boston, and our Provost Winston Langley, who would have loved to come and join us today, but he was not able. I just want to thank Dr. Sharif and Dr. Osama. I don't know if he's here, I wanted to tell him that we nurses love doctors too, so it's not only doctors loving nurses. So I am, like I was introduced, I'm the Dean and the Professor of the College of Nursing and Health Sciences. We are the 9th largest college in the United States, so we've got very large number of students. This is where our college is, so people who like to come and sunbathe and have their boats, because the university has the boats too, for students to tour or cruise around the city. We're on the water, and we are one of the most beautiful campuses. Or for somebody who comes from actually Lebanon, it's tough to say that anything else looks as beautiful or as Lebanon or as Cairo or Alexandria, I would say. But the College of Nursing and Health Sciences at the University of Massachusetts has a very, very important piece of real estate. We are right on the water. I wanted to start my presentation by having a saying, the future is not some place we are going to, but one we are creating. So we are the creators of the future. The paths to it and are not found but made, and the making of those pathways changes both the maker and the destination. So we are change agents. The challenges of nursing in the United States and in the world, we have a lot of similarities. One of the issues is that the role of nurses are becoming more complex. I'm not sure if you're following the news in the United States. The NCLEX exams have become more difficult to pass because of the complexity of the student's role. There are inequities in nursing education across the globe. That is not only true in the United States, but in the world. Some countries have less education or opportunities for education for nurses than other countries. Some communities have less opportunities for education than other communities. There are inequities in financial compensation for nurses. In some countries, nurses are paid very low. In the United States, they used to be paid very low. The salaries have gone up, but probably not as high as we want based on the complexity of the work we do as nurses. There are inequities in working conditions. People don't have the same compensation, the time off, the 40-hour week to do their work, and they are very stressed out. And there are probably not good strategic planning in the development and implementation of solutions to these challenges. So a lot of us know what the problems are, but we have not worked on how to solve those problems. The satisfaction with nursing care, the lower the patient-nurse ratio and the greater the education of nurses results in the lower the dissatisfaction with nursing care. So if you have more nurses on the unit, there is a higher satisfaction rate by the patients. There is a lower mortality in hospital admissions or readmissions if there is good nursing care. There is a higher safety and quality of care, and this is really supported by research. And there is lower rate of errors in care. So nurses make less mistakes if they are in a better working conditions. The public opinion about nurses, I've been all over the world, and I do know that nurses in the United States probably have one of the, can you hear me? Yeah, respected profession. And in some other countries too, like in the United Kingdom, Australia, New Zealand, those are the top countries where nurses are very high, or the image of nursing is very good. And in other countries, especially low-income countries, that is changing. I've been in Jordan. I am really impressed what Jordan has done in terms of improving the image of nursing and in terms of encouraging students to go into the nursing profession. I also was in Oman in Sultan Qaboos University, and I was told that it's the second most difficult profession to get in at the Sultan Qaboos University. So we're seeing that there's a tremendous change in the world and in the Arab countries too. The quality of nursing care contributes to the poor image of nurses globally because of reasons of shortage of nurses. There's a lot of burnout. There is high turnover. In Lebanon, we have probably the highest percentage of nursing turnover. There is poor clinical preparation of nurses. There is high patient-nurse ratio. We know that the less patients assigned to the nurses, the better the care is. There is inadequate supervision or oversight, and there is poor adherence or established standards of nursing care so that we know everybody treats the patient or they have the basic, knowledge about nursing care. And of course, there is a high degree of job dissatisfaction. The poor quality of nursing care due to shortage of nurses obviously ends up being lower quality of patient care. It also, we see across globally that there is lower educational levels in terms of the academics. The lack of evidence-based practice appropriate to the unique needs of population. We don't do enough research in nursing just like other professions. There are policies that do not support expanded roles of nursing or there are no national agendas. I am in the States and we have very strong lobbying. We pay a lot of organizational fees to help our lobbyists or our nurse leaders to go after our needs in terms of nationally in the United States. And we would like to see more of that in other countries. There is lack of organized nursing advocacy group to influence policy. In the United States, part of our tuition, our fees for being a licensed nurse or certified nurse goes to policymakers who work on our behalf to improve the image of nursing and also to improve the quality and the working conditions. And of course, the lower wages contributes to a lot of the dissatisfaction. We must understand the challenges, and I'm sure 90% or 99% of the people here understand that these are true and real challenges. And unless we understand those challenges, we cannot change our teaching, clinical practice, research, policy and politics, and service to our profession. How to address our challenges? Developing countries, or we could say low-income countries too, should invest in nursing education. We do have in the States ADN, which is associate degree, BSN, and advanced practice registered nurse, DNP, and PhD. And Cairo has all of them. And we did have diploma nursing, but those are very rare now, and they're all grandfathered. I do know that Egypt does still have some diploma nursing programs. And of course, we need research prepared nurses who are basically the PhD prepared nurses. So if countries don't have enough PhD prepared nurses, then their research activity will be actually not as well as in other countries. And of course, in terms of practice, we need to standardize practice. I know that the Arab world is struggling with this because there are no basic exams that licenses the nurses that proves that they all have the basic minimum standards in providing care through the accreditation and certification. We have a lot of ways of quality assurance, developing nursing specialties, establishing advanced practice nurse, registered nurses, and also evidence-based practice. As you can tell from this pie chart, you will see that 36.8% of nurses in the United States are baccalaureate degree, and the associate degree is actually almost equal. The Institute of Medicine has recommended that we have the nursing workforce be 80% baccalaureate prepared. And just to tell you that Massachusetts is 55% of its nursing. It's not only in other countries, but even in Massachusetts, which is known to be one of the most advanced states in the United States, has lower baccalaureate prepared nurses than other states in the United States. And as you see, the diploma nurses are very little, but we don't have new diploma schools. The master's degree, the doctoral degree, obviously are going to be lower just because it's a more advanced degree and that the opportunities are less than the basic. The improving nursing practice, we need to provide working environments. Now, when I was in Oman or when I worked at the American University of Beirut, that's where I graduated, the salaries were not good, but the working conditions were good. And nurses were paid or given free housing. So there are a lot of things that you can do that that doesn't include salary, but if you give them benefits, then it will make it a more attractive place to work. You can give them incentives like attending schools or university for free, improve pay